Here.
Commissioner Hagan,
Here.
Commissioner Levian,
Here,
Commissioner Mason.
Here.
the next is the review approval of the meeting minutes from August 1st. Somebody want to make a motion?
Make the motion that we approve those minutes as presented.
Need a second?
Second.
All in favor, say aye.
Aye.
Anyone opposed? Anyone? Motion carries. Next is the proposed fiscal year 2024 budget. Shannon.
All right. So the best way to look at this is to find this sheet that is all black and white. It's probably the third page and go past the color page. And if you really want, you line them up next to each other. It's the same thing all the way across, but this is the totals columns and the differences. I think Commissioner Hankins, you requested that we give a little brief explanation as to what the differences are and why, there's changes. So we went ahead and put that in there. Like the last budget amendment that we gave you, all these color columns are just each division's total, and then it all rolls up into this black and white page. I kept it black and white so it was easier and you didn't get lost in all those dark colors and dark print. So, go back here too far.
Third page in. So.
Yeah, this should be, they're that right there. There you go.
Oh, this one.
You got it. Yep.
Yeah.
So, overall, I will say that there's not that much of a difference from last year's budget. Looking from an accounting standpoint, it's a 1% increase, which in the world of accounting, we would call immaterial. I would say that the budget is relatively flat from last year to this year. We've had some programs roll off. We've had some programs not really start up, but just increase the funding, and it all washed out to about a 1% increase. We're really going to look at a high level today. We have another meeting scheduled on September 18th to really dive into details and go into it. But I'll be happy, as always, to answer any questions you have or to dive in. We can dive in today if you really want to. So today, my goal today is just to give you a high level overview and kind of introduce you to the budget. And then that'll give you time between now and September 18th to really look at it in more detail if you wish. So that's what we're looking at. Just some highlights. Let me see. Oh, I do need to thank our staff. Andrea Pierce is with me today. She is my right-hand person. We wouldn't have gotten this together quite as quickly without her, so I appreciate that very, very much.
Thank you.
The rest of our accounting staff is amazing. The directors that I begged and pleaded to get me a 2-page budget earlier than they're used to, they all stepped up and got it to us so we could get this prepared. I appreciate it. Dan, without your leadership, I don't know where we'd be. So thank you for that too. But I want to say budgeting is an art. It is not a science. It's not a science. And so if I had that crystal ball and I could tell you exactly to the penny where this would end up, honestly, I'd probably go play the lotto and retire tomorrow, but that's different. So here we are. County budgets are different than regional budgets as well. County budgets, you have a lot of other things into play. This is just regional, and we're just health department. So we don't have all those road commission type, a lot of more capital type projects. We just don't have capital. We offer services, and our biggest expense is people because that's what we do. Let's see, we do have significantly more grants than most county budgets. I know in talking to, I think Antrim County, they had 4, 5, 6 maybe grants a year. We're dealing with 70 grants a year at least. 60% of HDNW's budget is grants.
116 grants actually.
Well, in total, yeah.
Yeah,
I was thinking
total.
of the
Yeah,
renewals, yeah. We'll go 116 in total. And we also don't have a lot of discretionary dollars. We don't get money where they say, here you go do well. And we sit around and go, what should we do with this? That would be nice. We'd love to, but that's not how it works. Most of our dollars are dedicated to specific programs, certain things that we have to do, requirements we have to meet. And there's a lot of reporting that goes into that. And that's where our accounting staff comes into play because they are forever filling out those quarterly reports, annual reports, closing the monthly budgets and monthly. And so there's a lot of reporting that goes with it. Like I said, historically, we've pursued grants and innovative partnerships to keep our local appropriations requests low. We hope to continue that trend and keep moving forward, not asking for a lot of local appropriations. This is a balanced budget. You will see there's a little bit of a surplus, and that is due to dental because they changed their reimbursement rates. Again, I think we talked about this at the last meeting in January. It's not a huge increase because we always ask dental to include equipment that they foresee coming close to end of life and what they would need to replace. So we did include that into this budget. I'm also going to be conservative on the estimate for a surplus because I don't want to count my chickens before they hatch, right? Like, let's not pretend like we're going to have a whole bunch of money floating around and spend it. Let's see, we talked about being flat. There's a lot of estimates in here yet. State funding is not finalized, local funding is not finalized. So like I said, we've done our best with what we know today, but this will still be finalized and tweaked as the numbers roll in and we know exactly how things are going to play out.
And September 30th.
Our fiscal year ends September 30th. The state probably won't finalize a lot of their things until November, December. I'm looking at Dan and Andrea because they've been here for a while. It just takes them that long to get it together. So these are our best estimates.
They always send us an initial allocation letter, but it's based on exactly where our funding was in those programs at the time that they send the letter. So if it changes for fiscal 24, they haven't told us yet.
To be determined. Let's see. There is an EH fee increase in here for common services provided for Otsego County, and that's due to county funding shortfalls. We'll continue with these rates until the new local appropriations levels are determined in early 2024. So that's in here as well.
You have
All
a
right.
question?
I think we'll be addressing this in one of those in the meeting, so.
Okay. Yeah, and so that was a surcharge because we had asked for a certain amount of appropriations last year, and then we didn't, I think it was 3% less, so we make it up with the EH fees is kind of typically how that works.
I'll go into that in the meeting.
Okay.
Get to that point during,
Okay,
from our point of view.
okay.
All right, expenses, any other high level questions before I dig into some?
Under revenue.
Hmm?
Under revenue.
I'm gonna dig into revenue and expenses in just a second. You look.
I want to give you the opportunity to briefly explain under revenues on local grants for reclassification.
Mhm. So when we did all these 2-page budgets, all of the directors gave me, they have to fill out what the revenue source is that matches their expenses. And on a lot of these, you'll see under grant funding and local grants. Sometimes it's almost hard to differentiate that some of them can be either or almost. So I let the directors tell me what they think the correct funding source should be because they know the program, I don't. So that's the reclassification is in there. So, you see a little bit of shift from one year to the other. That's why hopefully going forward, it'll be consistent now that we've established that. That's the goal.
And
Did you want to add on?
Oh,
to
I was
that?
just gonna say, the reason we differentiate it all, instead of just having grants, is within the category of grant funding, we may have grants that have a federal origin, and we have to do separate reporting for the federal, so we like to keep it separate. The local grants are smaller, they tend to be the community foundations, but there might be some schools and different things, but we only put in that local grants funds that do not have a federal origin.
That makes sense.
Any other questions?
So we will be we'll have the vote in the next meeting on the 3%. So I think that would be appropriate to ask my questions there.
What 3% you're referring to?
Talking about the EH.
Yeah.
Oh, the EH fees?
I don't know that, I could ask or mention some things here. We were just in conversation with Mel this morning on the way over
Mhm.
for a more detailed explanation to, Of course, in 2021, the health department waived their initial funding increase requests, so we technically funded them 100% for 2021. And were provided the normal rates for sewer, water, et cetera, inspections. And of course, what's going on now, because we've funded less than 3% of full funding to the health department. My understanding is we make up the difference with sewer and water.
Yeah,
With
so
those
big
permits.
well permits.
Right, so
Food
that,
service license.
so you're getting that money through that funding.
Right,
But then in 2022, we were back to having higher rates for inspections, since we didn't provide the full 100%. But they have for years not provided that. Also, the waiver in 2021 was due to COVID, not sure if all counties received it. We did not ask for the waiver, it was a letter sent to us. And then she's got this breakdown, explaining how the funding has been made up for that, which we'll be voting on during the meeting coming up.
I think, is that something that you can send to us and then maybe before the
Yeah, I can
next,
probably send these.
yeah, like the September 18th meeting, we can take a close look at it, and we can actually reach out to Mel and talk about some of these things too, if necessary. Mel, you're talking about your.
Mel Meyer,
Yeah,
right.
your finance director, right?
I kept thinking Melanie like this one.
I'm sorry.
Yeah.
Didn't know we were talking.
Yeah. I got it. Look here, yeah.
My apologies.
Confused.
So that's the Otsego County Finance
Yes.
Director?
Yeah.
Yeah, so that,
Confused to what?
Like her, she's on top of it.
yeah, so it has to do with, so when we ask for local appropriations from the counties, if we're given less than what we were asked for, we would make up the difference with the surcharge and environmental health fees for like septic permits, well permits, food service licenses, things of that nature. We do a calculation and then base that on that. If we are, the local appropriation request, if it's, whole, then that doesn't happen. So only, I think last year was just Otsego County. In years past, it had been Charlevoix County was one that we had a surcharge for, and it was, I think the one in Otsego County is like $10 or $15 on top of what everybody else has as a license fee. It wasn't a lot. There wasn't a big difference. It was only, it wasn't that much.
So you look at that every year for every county?
Yeah, so when we send out the request back in May,
July, yeah, somewhere.
yeah, May, June, somewhere in there. And that's the amount of local appropriations that we request. And then we typically don't see what those are until January, right? And then after that, in January, once, okay, some counties have at different times, for whatever reason, have said, well, you asked for this, but we're gonna give you this. And that's how we made up the difference, in those counties.
I think part of the reasoning was it's not fair to the counties that are fully funding the request. Like they're fully funding it and then other counties are saying, no, we're not gonna do this. So, how do you try and true that up? So.
Yeah,
that's where it came into play.
well, I will say the reason for the denying of the 3% is when you look at the counties, perhaps in general, but certainly Otsego County, their wages and their benefits are not on par with that of the health department. And they felt that the 3% was something we'd better use for ourselves for funding, even though they're still not on par with our counties. I mean, we're not on par with you. Because you do have excellent benefits and excellent salaries for your employees, that counties do come up a little short on that. I mean, they're not complaining, but
Yeah,
that's the reason for the 3% variance that they, for the lack of, for the
But
complete
it doesn't really
100%.
see what staffing does.
Well,
Wages,
no,
does
their
it?
justification is,
Oh, that's what
you're not
saying.
in your counties, in our counties, we're not paying those employees what the health department employees are receiving
But
as
this
salaries.
isn't about wages, is it?
Well, the 3% is. I mean, the
Well,
3% has been
And we haven't asked for an
Yeah, we
increase
didn't.
Okay.
for 2 years. in a
Correct.
row,
You-
basically.
I wanna
This is
understand
a
what
2-year-old.
percent that you keep referring.
Okay, the 3%, the total budget, we're paying something like, I believe, 62,000, slightly more than 62,000 per quarter. And most of you are somewhere in that ballpark. You're very close to that in your own county.
So
And
you're talking about a 3% increase on the local appropriations?
so those appropriate, so the 3%, we're not paying full 62,000.
They're paying
We're
3%
3% less than that.
Okay.
And the 3% less was, was for that reason.
Okay.
In other words, budgets are going to grow tighter, and this has been going, we've been doing this for a few years, is my understanding. In 2021, we had full funding. I think that was the year it's on
It was 2 years ago.
2 years ago. So that year was the full funding, but beyond that, even prior to that, at least for some short period of time, and now at the present, in 2022,
Mhm.
back to the -3% for full funding.
So I know in our budget, we're looking at now, it tells every county an appropriation amount of money.
Mhm.
So are you saying that Otsego will say, we're not gonna give you that amount of money, we're gonna give you what we wanna give you?
Yeah.
How? We don't do that.
Yeah.
That's a good deal.
So we calculated it.
Maybe it's not a bad thing.
Well, and
You
that's
take care
what,
of your county.
yeah, and like
There's
Shannon explained, I mean, the way to even that out is, for user fees, essentially is what they are for permits and licenses in that particular county. That's how we make up the difference if that happened.
So you
Um,
increased their user fees for that county.
Right, it was a surcharge, and like I said, it was $10 or $15 more than what everybody else was paying, and we would do that calculation based on like a weighted average over the last 3 years, in January. We wouldn't just pick that number out of the hat,
So you're
we would.
saying, if the county doesn't pay the health department for the correct appropriations, you're passing it on to your taxpayers instead? Would you say
In that
that's correct?
county, yeah.
well,
I mean, well, we're to the users for they might not,
Not
whoever's
necessarily the
getting pulling
taxpayers.
permits, not necessarily taxpayers.
Well,
Correct.
It's just the people using it.
Yeah, whoever's using the services in that.
Correct.
So
All
it's
new
really-
homes, all new homes.
It's really unfair. It really should be spread out to all of the taxpayers rather than just the more expense on somebody that's doing,
Well, it isn't that we asked them to do that.
well.
That's
I
how
don't-
they meet
and
their
I don't know
budget.
How else they're gonna do that, but.
Yeah.
Well, and I would say too, I mean, just, from our standpoint, as far as like wages, staff wages and whatnot, I mean, we have different types of staff between counties and the health department. We have a medical staff, primarily with nurses and, mental health professionals and things like that. So it is a little bit different, and we have to try to stay competitive in that market, else we can't hire anybody, so. That's one thing.
So your ideal is I guess my question is, how do you decide the appropriations? Is it equal between the 4 counties, or does it go by
It's
population?
population.
The population,
Yeah, it's
okay.
based on population,
And it's so much money per population.
correct.
That's how we do it in LA.
Yeah, and there was a little bit of an adjustment last year because of the new census.
Right.
So some,
Some changed, yeah.
some changed a little bit,
Yeah.
right? Yeah, because population changed.
So. All right, we'll keep moving unless we
Okay.
more about this one.
You're still on revenue.
I know, we're on revenue. Let me jump to my revenues. I heard mine backwards. So fees and collections increased. Most of this is dental services, which we've talked about before, and then some of the school services that we've increased over the years. So that's a lot of like our behavioral health type services that we offer. You will also see that state funding decreased, and that's because we're not getting that state plan amendment dollars through the dental program. They've changed their reimbursement rate. So what we used to receive in that line, we're now collecting more in fees and collections. So one goes up, one goes down. I'm just gonna kind of skip to the highlight ones. Grant funding has decreased. This is a net result of programs ending, programs with reduced funding, and some of that reclassification. So when all was said and done and all the differences were inputted, we decreased some. You will see on the local grants line, though, a lot of that decrease in the grant funding line is made up in the local grants line, so. At the end of the day, it's, you know, the rest of them are pretty minimal, increases and decreases. There's a lot of details here. I don't want to go take up all of your meeting reading each and every one of these. I think you all are more than capable of reading them. But if there's anything that jumps out at you that you're wondering or have questions about, I'm happy to answer those. At the bottom, it's an immaterial increase. We're increasing $339,646 out of a total budget that's $34,394,029. So that's, you know, a 1% change, as I said earlier, that's holding pretty flat. If we want to talk about expenses really quick, salary and wages. We reviewed this budget extensively this year for salaries, wages, and fringe benefits. My goal coming on board was to clean this part up because our greatest expense is in these two line items. It's 47% of our total expenditures is in salaries and wages because we offer services. We don't make anything. We don't construct things. We don't have capital projects. This is what we do. So you'll find most of our expenses are in these two line items. I felt that if we could get these a lot tighter and really clean it up, then I would have a lot more confidence going forward in this budget being as accurate as we could possibly make it. Again, based on a lot of assumptions and money that's not
Do you know
here.
how many employees you have?
How many employees do we have? 4.
Basically, the health department side, it's around 170, and it's similar for the dental side too. But I don't have the exact number for you.
Yeah.
On the, I think I have a better exact number for the health department side.
So,
Yeah.
so the 211,000, is that an increase in employees? Cause I know you had more for dental clinics north.
So that will show up down further. The dental clinics north will show up in, where is it?
So is that just increases or is that even more people?
So you have to remember, we had a 3% Board of Health approved salary and fringe increase this year. But then you've also had some people that have retired. You have some people that have left the department for whatever reason.
Right.
So when it all netted out, the increase was only 2%, even though we
Yeah.
had a 3% salary increase. So you know, we've tightened things up, but we've also increased where we could.
And
So
you reclassified, so that took care of stuff.
we did, yes. So.
And if you recall, there was a second deputy health officer, which we did not fill.
Yeah.
Shannon, the fringe benefits,
Mhm.
Your health insurance costs, I know the county, our health insurance went up,
Yep.
and I find it interesting that we're having a $70,000 decrease.
So what we
Are we
did,
changing, my first question is, are we changing any of the fringe benefits for employees?
not to our knowledge, we have not received our benefits package for 24 yet.
Okay,
But to our knowledge, it will remain the same at this point in time. What we did last year is we knew, so let me back up. 2 years ago, we had a lot of high dollar claims. There were a lot of emergencies and things like that with our staff.
We're self-funded.
That was my next point. We are self-funded.
Mhm.
So if we have a lot of those high dollar things, we have to pay for it. So that drove our costs last year up higher and we knew it was gonna be higher. So we accounted for that in the budget. We over accounted for, we didn't have as many emergencies and high dollar things last year as we had the previous year. So we had accounted for it conservatively. We didn't need it all. So we backed it back down a little bit this year. Now, do I expect our health insurance to go up this year? Probably.
Probably.
Probably. I mean, if it didn't, I'd be like,
I think ours was like a 10% index.
yeah, so we're trying to find that balance point because we are self-funded. If we have a bunch of high dollar claims, it puts us in a really interesting place. If we don't and everything's good, then you roll with it.
Who do we provide, what company do we provide right now for health insurance?
We have
Blue Cross Blue Shield.
Okay, so we, as the county, we've had priority health for a number of years.
We looked at them last year. We asked for a bid from them.
We are moving to Blue Cross Blue Shield because over, I think, a 3-year time period, we're gonna save like $285,000. By
Last-
going to Blue Cross, which used to be
Right.
The platinum.
It'd become
the
more
standard.
competitive,
and-
right?
Right, so,
So last year when I came on board, Blue Cross came back to us with a much higher rate and we said, let's go back. I said, go ask for a rate from somebody else. Let's get competition in here and let's see if we can't drive it down. As soon as we told Blue Cross Blue Shield that we were gonna go get another quote, they immediately took off, was it what,
Yeah.
$10,000 or something? It
No,
was
50.
50,000?
Wow.
Yeah, they immediately took $50,000 off,
you'd think it was like a money game or something,
right?
but it's in to make money.
Yeah.
So,
Yeah.
yeah, we did the same for
Okay.
that reason.
Good, okay,
But that's a really good question. I'm glad you caught that one.
yeah.
I don't think health insurance is ever. gonna
Well, I like
do
to
that.
see decreases, but when I see health insurance tied to a decrease, I think, hold on.
Something's
Yeah.
not right.
There's a big red flag waving for me.
I
Yeah.
agree.
All right, thank you.
You're welcome. Did you have any other questions with that one? Okay, all right. I do, let's see, we talked about the salary increase, even though it netted 2%, we had that 3% in there. I do want to jump down to the contractual line item. You'll see that that's up 352,000. There's your dental salaries and fringe.
That
That's
was
where
my
it comes
question,
in.
what that
Yeah.
was. Okay.
Yeah, they have filled some of their vacancies. They're getting, more staff on board, so that's where you're gonna see the increase in that line item. Let's see, they're also providing more services, so it's twofold. It's not just
And collecting at a higher rate.
and collecting at a higher rate, yep. So. I do want to mention the travel cost line item. This was one of the very few line items that we have some control over, not much, but some. And we've really, as we like to say, tightened our belts and said, okay, let's not be traveling all over the place. We're coming out of this pandemic. Let's get back to normal. Let's tighten it up if we can. And so the divisions reduced an average of 33% in this category. We did have a few programs that ended, which helped, but by and large, we really said, let's tighten this up. Let's not be all over the place if we don't have to be, so. Let's see, where else am I? Oh, the other expenses category, I'm still breaking this out and I will continue to break this out going forward. But that is driving a little bit of this differences here because we've just broken it out from, before. Some of these have been reclassified. As we broke it out, we kind of went, oh, you know what, maybe this one should be in this category and not this category. So we're still refining it. It's much cleaner than it. I just like it broken out. I would rather you be able to see what's in other expenses than to have it all lumped together. So
Everything from health services down to the other expenses line.
thank you.
The computer software, other contractual advertising and other, that used to all be on one line item.
Yes, and it
Yeah.
was too big.
So, thank you, ladies, both of you,
Yeah.
for breaking that down more. I want to go on record as saying that I trust you, okay? Meaning that if I didn't trust you, I'd be much more inquisitive about it. You can throw this figure at us with $34 million on it and shuffle money that we're not gonna catch. But by you breaking it down a little more, it makes it easier for us to understand thing number one. Thing number two, I do trust that you're trying to be as transparent as possible. So I appreciate you putting forth the extra effort and I'm not saying anything was wrong in the past,
Right.
but you don't know what you don't know. So you guys are helping us to know better. So thank you for that.
Absolutely. Our
Well,
pleasure.
and it's helpful for us to know what doesn't make sense to you. We're in this every day of the year, you
You
know.
can show us,
Sure.
this could be 2 lines,
Mhm.
income and expenses.
Yeah, we could.
We don't say, hey,
What is
just
that? Yeah.
exactly what is that? And yeah,
True.
And interestingly, the categories where it ended up all is grouped into other, because when I came in, I thought, that's a lot. But it's how we report to the state. When we fill out the quarterly and annual reports that we have to, on all the programs, we will add those all back together for reporting. So that's how it came to be.
So when they do your audit, do they break these out too? Or they just did other?
So the audit is looking more
Previous-
at, the audit's looking more at our controls and how we're doing the accounting, like, do we have checks and balances in place? Is there any, issues that we see? They're not really going through in detail of every single number. They're gonna look at, are you accounting for this correctly? If the process isn't right, then they're gonna jump in and audit all the details, but they don't have time to do
The
it.
state has to trust that we're doing our part.
Do you have to do chart of accounts like everybody else, the same
Mhm.
with the state?
We
We
don't,
choose to do it the same as the state
Oh, you do?
because we have to report.
well, I think she's talking about the counties all have a uniform
Oh,
chart of account.
sorry,
No, we don't.
So
We're
you don't
not.
have to do that?
We're similar, but not quite the same.
Okay.
Yeah, we don't have, we're not required to do that.
Oh, that's good.
But again, when it adds an extra step when we go to report this every quarter, every year for our annual reports, our staff now has to put it back together, take it apart, put it back together, take it apart. when
And you
we're
said you
doing
have to do that quarterly to the state?
Some of
most
them,
of them.
yeah, most of them, some of them are monthly.
Yeah, our grant dollars are heavily watched by the state, so it's not like we can just do whatever we want to do and turn in a receipt. I mean, it's, here's what we're going to do, and then you come back. If you vary by, is it what, 10% on a line item?
$10,000 or 15%, whichever is greater.
So is that, all those reports tied to the state funding? Or no?
State and federal.
Yeah,
typically.
the state CPBC line, the state cost sharing ELFs line. Those are the ones that we do, but that's not the only ones. Almost every single grant that we have as well. And that gets a little more complicated because they provide forms and they're not all uniform.
Yeah,
Yeah,
Right.
They don't
so-
work.
no, they're all different. It's kind of like the credit card machines in the stores, every single one is different. Yeah, same thing.
It's a good analogy. I like that.
It's true.
I keep waiting for them to make them all the same.
Anyway, so our other expenses are all broken out. I do want to make a note here that our computer software, our IT section has done a really great job. When Tim came on board, which was just before, his first day was for my interview. I remember that. But he's really gone through and said, okay, let's look at all the licenses that we have. Do all these people still work here? Do we really need all of these licenses? And we have cleaned it up significantly. So it's $30,000 less, partly to that, getting that cleaned up. So I gotta give credit where credit's due, and Tim deserves that one. Equipment costs have increased. This line item, it's typically our EH laboratory where we do water testing. We also do, like disease testing, all kinds of testing, and get the Gaylord office. And then also the dental team, their equipment, they've been around for a while. Some of it's getting to end of life. They just need to replace it. We will do our best to get as much as we can from this line item for them. But if we have to cut something or something's coming in short, this is usually the first place that we go to cut back and not, we say, hey, hold on, let's not purchase 12 of these, let's just purchase 11. I'm just giving an example. But that's usually where we look first, so. All that to say, again, it's a 1% increase and there's gonna be a little bit of a surplus, mostly due to, it is due to dental. That's their increased fees that are rolling in. And again, we're gonna be conservative. I'm not gonna say, oh, look, we're gonna have all this extra money, let's go buy a bunch of stuff. There are fund balances that are required to be maintained by the auditors, and there's places where we really should be using that if we do come in with a surplus, so. In closing, let's see, it's a balanced budget. We look forward to Board of Health approval on September 18th and further discussion through all of this. If you have questions, I'm happy to answer them today or before the next September 18 meeting. I'll be happy to help explain.
So the question I have is that in 2019 budget versus the pandemic in 2020, came along, the budget increased like $3 million or whatever, and now the pandemic is over with. So, we need an explanation of why the budget didn't go back down $3 million or whatever, you know?
So inflation is one. Everything's more expensive. We've gotten a lot of schools, as Andrea mentioned, we're offering services in schools that we had never offered in the past, prior to the pandemic. I will say the COVID related dollars, the COVID specific dollars, they're going away. They're headed out. The little bit that's left is gonna roll off this year, and that'll be the end. So the majority of it has gone. There's only a little bit to finish this off.
Dan could probably also speak to our lab has expanded a lot. It was just the regional lab before COVID, and now we've got the increased lab services. Maybe you can speak more to that than I
Yeah,
can, but
correct. Yeah, that's true. Yeah, we're doing more with, water testing has increased, beaches, beach monitoring, we're doing, source tracking, and then we're trying this new, method for rapid methods. So currently, right now, we take a sample at a beach like today, and you don't know the results till tomorrow, right? Which that's like the standard method, and it's always been problematic because basically you're telling people, you know, it comes back high today, you're telling people that swam yesterday that you shouldn't have swam, you know? So then so it's always like a 1 day lag. So, you know, we have gotten funding from Eagle to, you know, basically, get this, rapid method process up and running. So we've been working on that for the last year and going into this next year. So hopefully that's going to be the new standard going forward. Our clinical lab, you know, we're branching out. You know, it's kind of started with Andrew is right that with COVID, and remember at the time where everybody's like, you know, wanted to get COVID testing and there was no place to do it. Well, that's kind of the reason the lab got back up and running after several years hiatus, because that was a need in Northern Michigan. So we've also expanded to be a center for testing for other health departments in the region to send what they're currently doing, not COVID related, but just their normal testing for STIs, sexually transmitted infections and things of that nature to our lab. And we're trying to, you know, continue that expansion to get all the health departments in the region to start using us instead of sending it down to Lansing, because our turnaround times are way better. And we're just, you know, trying to basically make the case that we're a better lab to send your specimens to, even though we are an arm of the lab in Lansing, the main lab in Lansing. So that's kind of where that stands. We've also, our molecular biology lab, which was also a result of COVID, was for wastewater surveillance, which was a big national project. And we are hoping that will continue looking at other diseases that we can look at in wastewater and hopefully predict outbreaks before they happen. So that's kind of the rundown with the lab.
So, yeah, I think you need to be prepared to answer that question over and over again, because it's probably one of the main.
Yeah.
in the dental services.
I was gonna say, dental has really expanded big time. That's probably a big,
Well, they
Part of
weren't
this.
operating during COVID. I mean, that was,
Right.
nobody went to the dentist.
Well, dental went way down. You know, we had
Yeah.
those, you know, COVID related grants to basically have the health department doing everything that they were doing regarding mass clinics and dealing with that. But now it's kind of gone the other way where, you know, dental has rebounded. It's not that we've expanded, it's just that we went back to where we were pre-COVID when it went way down. And I think it's, you know, the services, what did we have, 30,000 plus clients that we serve, and like 60,000 services. I mean, it's quite a bit.
So would it be fair to say that looking at the numbers, it's been almost 3 years since the beginning of COVID and all the COVID money handouts with the 9% inflation? Do you see any of that in your numbers as being COVID related?
There are, hold on. Get this ready too. Hold on. Or did you pull that up? Okay, so I have, let me see, 1, 2, 3, 4, 5, 6, 7 things that are left. No, not even. I take that back. I forgot that's lab.
Yep, that's lab.
1, 2, 3, 4, 5. 5 pieces of funding that are still COVID related, but it's minimal compared to where we were a year ago. And like I said, those are all going to be rolling off. Probably in this fiscal year, the majority.
Could you explain to me, the next pages? I know that this goes to this.
Yeah, so this is the full unabridged version. If you can't sleep at night, you can read this.
And I want to understand it.
Yes,
That would-
so the colors coordinate to this
Right.
very first page with all the different colors.
Most of them.
And this
Most-
total administration
yes.
division is the same number, but
Right,
there's this extra column.
yes.
I don't-
Well, so this is by program. The long abridged version is every single program that we have, every program code that we are charging to, all the way across the top. And it just keeps going for 16 pages.
Like this.
Is there, yes. So if you look at this first column, that administrative division,
Is this.
we have 2 program codes that we are charging to. 101, which is our general one. And then there's a CDC infrastructure grant that's coming to us. So that makes those 2 together, you get your total, which is that nice whole column that's
Right.
yellow, and that ties back to this yellow column on the summary sheet.
So what are all these that you break out? I understand the columns, but what, is it just
All of our
more
programs,
specific? It's all program.
every program, yeah.
Okay.
And
There's a
the
different
BHO is
program.
that dental health offices.
No, deputy health officer. So Holly oversees a few of these programs that kind of fall into that gray area of not really in family planning or, I'm sorry, family health or community health. So there's a few, and they're kind of an administrative function, but we need somebody to really watch them carefully. So Holly's taken on that.
Okay, I
responsibility.
understand it now. I
Yeah.
didn't understand how that
And
worked.
all of these different grants, they're separated, mostly they're different programs, but also they're different funding sources. They have to be reported separately, those, state reports. You can't just group them all together. Every single fund that they give us money, for a program, then they have specific requirements and things that we can spend, things that we can't. And so we do track all of it separately. And that's the big one.
Yeah, so this is the long unabridged version.
That makes sense.
If
I
you
do.
have questions about it, you can.
Now we
through
know,
that,
follow
yes.
your map.
Yeah, I know.
And there's lots of acronyms, so if you have any questions on
Yes.
those, please let us
Ask
know.
us,
Yeah.
don't hesitate. We know there's a lot.
I don't have any questions. Anybody else? Almost 9:45.
Oh, I'm good.
Good questions. No? Does anybody have any public comment? Then I think, unless we have something else, we can adjourn.
I don't think we're voting today, because we'll do the final vote on the 18th.
thought.
This is just the presentation.
So it'll be,
Thank you, though.
so
Good.
it'll be October, there'll be a vote,
Agenda.
right?
No, it'll be
There's another
September 18th.
Okay, we'll vote here on September
I don't
18th.
know.
We're
No,
taking
no,
the
home
board.
meeting.
I don't know that we were having a person.
Okay.
Finance committee. yet.
The
No,
whole board.
it's a whole board
Yep.
special meeting on the
Okay.
18th.
Yeah.
Oh,
This-
okay, yeah,
this is-
that's right.
This is big enough to go
Do you
straight
want
to
us
the
to
board.
approve the budget that day? Or would that go to a board meeting?
Well, no, that's the special meeting, so that we could have this meeting and not have to have the vote today, have an opportunity to discuss it with the finance staff, have an opportunity to review this before we get to
The 18th.
that vote on the 18th.
So we need to vote on the 18th.
Yeah,
Because our
Yes.
next
Full board.
full board meeting would be in October, and it's too late at that point.
exactly.
Yeah, the 18th, we have a decision on the budget.
Yes,
Okay.
you're sharing this same document with the remaining board members, correct?
Yes, sir.
Yes.
Okay, if we have nothing else, the meeting's adjourned at 9:44.